Now, whenever you are going to study the face, we are going to cover two extremes of the face. One is that face is having two sets of muscles which has got two defined functions. One kind of muscles in the face we call them as muscle of facial expression, which these actors are dominating over. So, which has a profound control on those particular muscles of facial expressions, and we give the expressions based on that particular mental state that we have. So, those muscles of facial expression are supplied by some different nerves. The second action we have in the face, we have called them as muscle of mastication. That means whatever the foods we are grinding, those muscles are innervated by some other muscles, and those muscles are producing some different actions. So, the chewing movement or the movement of the jaw is controlled by this particular muscle, we call them as muscle of mastication. So, two sets of muscles are there, we should not be mixing up with. So, muscle of expression is different that of muscle of mastication. So, expression is supplied by this cranial nerve number 7, which is known as facial nerve. So, facial nerve supplies the muscle of facial expression, the sorrow, grief, anger, whatever the joy we have, those muscles are expressing, we call them as muscle of facial expression, and those muscles are supplied by this dedicated nerve, we call them as 7th cranial nerve, we call them as facial nerve. Now, whenever you are chewing the food, we are exercising some different muscles, we call them as muscle of facial expression. So, that particular muscles are involving the temporomandibular joint. So, that particular temporomandibular joint is basically grinding the food material and helping this particular chewing actions, as well as helping us in articulation. Whenever you are talking, this particular movement of the tongue as well as this particular opening of the mouth is synchronizing, so that we can just like doing this particular the chewing actions as well. So, there are two sets of muscles are there. The muscle of mastication is supplied by the cranial nerve number 5, we call them as trigeminal nerve. Trigeminal nerve is supplying the muscle of facial expression. Now, apart from that, we have some other things which is important. These actions of the face, we call them as sensory supply of face. That means the touch, pain and temperature, that is also different. So, the touch, pain and temperature sensation, that means the sensory actions. If you touch this particular part of the face, we are recognizing that this part of the face is having any kind of like a stimulus. So, that is again carried by something else. So, that is not mixing up with these particular actions of facial nerve or muscle of mastication. Do you understand the motor actions and the sensory actions? Yes or no? What do you mean by the motor action? What do you mean by the sensory action? What do you mean by motor action? What do you mean by sensory action? So, you have 1.5 months left to understand this, and if you are not doing, nobody is going to make it for you, is not that? So, what is a motor action? What is a sensory action? What is motor action? What is a motor action? Please stand up here. What is a motor action? Muscle to spine, related to the pain, that is motor action. Stimulus to muscle to the brain, and then what do you mean by motor action? Stimulus to the muscle to brain, and what is the sensory action then? What is the sensory action then? Huh? What is the sensory action? Sensory action क्या है? What do you mean by the sensory action? What is the sensory action? So, what is that? Skin to sinus. So, what these particular nerves are doing? Carrying the sensation. What do you mean by sensation? And what is the difference with this motor action? So, what is the fundamental difference between a sensory nerve and a motor nerve? Skin to brain. So which one is brain to motor? Brain to muscle. Motor. And what is sensory? Skin to brain. What do you mean by the sensation? What is stimulus? Touch, pain and temperature. So summarize करो क्या बताया? Skin to brain is sensory nervous system. What does it mean? What ये क्या करता है? This is a sensory thing that is coming over here, touch, pain and temperature. So it is written over here V1, V2 and V3. That means this is a trigeminal nerve. It has got 3 division branches. So this sensation from this region is taken by the V1 branch of trigeminal nerve. It is a V2 branch of trigeminal nerve and this is a V3 branch of trigeminal nerve. We call them as ophthalmic, we call them as maxillary and mandibular divisions of ophthalmic nerve. These are carrying sensation from this face. That means this point you touch it, it carries the sensation. It is touching over the cheek. This point you are touching over this particular region, which is innervating over here, is something is touching in the forehead. And this information from here is going to brain. This is called as sensory sensation. So that means if you have any pain here, this particular nerve, trigeminal nerve, V1 branch is carrying the sensation. The muscles of this particular face. That means this is denoted with the motor action. Now this particular motor actions, we call them as 2 sets of muscles are there. Muscles of facial expression. And this particular facial expression, that means from brain to this muscle, they are giving this particular actions and these particular muscles are obeying that, doing actions. That means contractions or relaxations or making movements in the joint region. That is what they are making. This kind of thing we call them as muscular movement. There are 2 sets of muscles there to follow this command which is coming from brain. One is muscle of facial expression. That means they are giving the expression, pain, horror, whatever the things they have. And other is, we call them as muscle of mastication. So this is what we call them as facial muscles demarcated with. So this is what we call them as muscles of facial expression, which is present around this particular eye or eyelid. We call them as Orbicularis, Oculi, and which is present in this forehead region. We call them as corrugator superciliary. We have the muscles which is moving this eyelid. We call them as levator palpebrae superior, which is muscle present in the forehead. We call them as occipitofrontal, which is present in this particular region of the face. Other than this, we have some muscles present around the nose, around the cheek, zygomatic major, zygomatic minor, levator labia superioris, nasalis. These are the muscles which are present around this particular nose region, procerus over here, Buccinator. These are the muscles present on the cheek region. So these are the muscles which are going to give you various expression. We call them as muscle of facial expression. That means they are motor actions. Now this particular muscles which are doing this particular actions, which we call them as muscle of facial expression, they are motorly innervated by cranial nerve, which is known as facial nerve. Facial nerve, if you count down the nerves which is present in this particular algorithm, we call them as 7th cranial nerve. So this muscle of facial expression that we have, whatever the movement we are making around the eyelids, around the nose, around the mouth, around this particular cheek region, they are giving a muscle of facial expression which is innervated by cranial nerve number 7, also known as facial. This is one set of this motor actions. The other set of this action we call them as muscle of mastication. That means these particular muscles which they are present in this particular region, they are helping in chewing the food movements. They are known as muscle of mastication. There are a number of the muscles which are present in this particular face region. We call them as muscle of mastication. Masseter. Number 2, we call them as Temporalis. Number 3, we call them as Pterygoids. There are 2 such of them, lateral pterygoid and medial pterygoids. So counting together, there are 4 prime muscles which are known as muscle of mastication. So this Masseter, Temporalis, Pterygoids, they are all related to muscle of mastication. So muscle of mastication, they are present also in the face region, but they are innervated by some other nerves. The motor innervation comes from cranial nerve number 5. That same cranial nerve is putting this sensation and as well as giving this particular motor actions. That makes this particular cranial nerve, which is CN number 5, is sensory nerve as well as motor nerve. That makes this particular cranial nerve as a mixed kind of nerve. So this particular cranial nerve have got different branches. 3 of them are there, which is taking the sensation from all over the skin and the forehead region, and as well as supplying the muscles of mastication, which are taking the action of the movement of this jaw or temporomandibular joint action. So together they are doing this both actions, sensory actions and as well as motor action. We call them as muscle of muscle of mastication, having these 2 actions. In this particular regions of this particular brain. But apart from that, the blood supply in the face region is coming through the arteries. We call them as facial artery, which is a branch from external carotid artery. So the innervations, which is coming from 2 different nerves, trigeminal nerve and as well as facial nerve. The blood supply to the face region is coming through this particular branch of arteries. We call them as the facial arteries. The facial arteries, which is a branch of external carotid artery. So facial artery is coming from this particular artery. This artery you are seeing here is present in the neck region. This artery we call them as carotid artery. There are 2 sets of carotid arteries are there, external carotid and internal carotid. The external carotid supplies this particular head, neck region and as well as face. From this external carotid, this is the external carotid which has the branches. It gives a branch which looks like a tortuous. So this tortuous branch we call them as facial artery. This facial artery comes from this angle of the mandible, enters to the face region and runs to this angle of the mouth, then goes to this particular lateral side of the nose, ends in this particular angle of the eye. So this course, which is taking an upward route over here in this region, have a tortuous course, we call them as facial artery. This facial artery supplies with the different branches, nasal branch, labial branch, mental branch, etc., etc., supplies this particular entire face region. And as well as another branch which is coming from transversely, we call them as transverse facial artery. That too supplies this face region, which is giving this blood supply to this muscles, skin, etc., etc., over this particular region. So these are the facial artery which is supplying to this particular region in this particular face. So this facial artery, which looks like this red one that we are seeing here, coming from this particular neck region and climbing over here, that we have seen in the dissections, is a branch of external carotid artery. Counter to this particular face, which is coming from this particular facial artery, the corresponding thing which we call them as veins, we call them as facial veins, which is running through this particular vein, we call them as facial vein. They also have the same course, starting from the angle of the eye, coursing down and towards this particular angle of mouth, then coursing to this particular carotid, these neck veins, we call them as jugular vein. So this particular vein, as you are seeing here, draining this vein, we call them as facial vein. This facial vein, which is present in here, as you are seeing here, this do not have any valves in it. So it is kind of a single vein which is running across, don't have valves. Now this particular facial vein, as we are seeing here, has a connections with these veins which is present in the deep tissue. We call them a deep facial vein. So these veins which is running deeper in the substance of the face, we call them as deep facial vein, has a communication with these veins which is present inside the brain. We call them as cavernous sinus. So this facial vein which is running superficially, having a connecting vein, we call them as deep facial vein. So deep facial vein has a connections with these veins which is present in the brain, we call them as cavernous sinus. So as a result of that, if you have any infection in this particular region where this facial vein is there and which is draining to deeper veins, we call them as deep facial vein. So infection from the face can travel backwards, reach to this brain and infect the brain region. So that's why we call them as this particular region of the face as a danger area of the face. Which area of the face? Normally over this particular region which is making a triangular shape over here, from this root of the nose to this tip of the nose to this particular upper part of the lip. So this region of the facial veins which is present in here has a communication with the deeper veins of the brain. So if you have any infection in this particular triangular shaped region of the face, this region we call them as danger area of the face. Why you call them as danger area of face? because infection, if it is not taken care of from this region, can go to these deeper veins. Through these deeper veins, deep facial veins, it goes to this vein, we call them as ophthalmic veins, deep facial veins, and through this particular vein it reaches to this venous plexus, we call them as pterygoid venous plexus. From this pterygoid venous plexus it reaches to the venous plexus in the brain, we call them as cavernous sinus. So infection from the face can reach to the brain through traveling through this particular set of the brains and infect the brains. That is why this region, which is known as middle third of the face, we call them as danger area of the face. So regard to this particular face and facial drainage, that you have to keep in mind. So this particular sets of the vein that we are seeing here, this facial vein has a communication with the veins like this, these veins. So this is superior inferior ophthalmic vein draining to this particular vein, which is known as pterygoid venous plexus, which is deep veins which you are seeing here. These deep veins plexus communicates with these plexus inside the cranial cavity. This cranial cavity plexus, we call them as cavernous sinus. So this infection from this region can travel down to this particular deeper regions of this face to this particular brain. So that is why we call this area as danger area face. This is one of the explain why question, inspection like a danger area face, which is one, and why this particular called area called dangerous area. So this is about the facial vein which you are seeing here. The facial vein is more important than that of facial artery, and this facial artery is having this particular same course that we are saying like facial vein, but the clinical importance of the facial vein is more important than that of facial arteries. And other than this facial vein, we have a transverse running vein, we call them as facial vein. Transversely running, we call them as transverse facial vein. So these are the two sets of vein in this particular facial region. Now coming to this particular facial artery, as we are seeing here, this particular facial artery making a course like this, coming from the angle of the mandible. So reaching at this particular angle of the mandible, we have this particular masseter muscle. So this muscle, as you seeing here, present on this particular masseter muscle is present on this particular region, we call them as mandible. So this ramus of the mandible, which is present in this particular region, covered by this muscle. So this muscle has got two borders. This border we call them as anterior border. This border we call them as posterior border. So this masseter muscle have got two borders, anterior and posterior. In this anterior border of the masseter muscle, this particular facial artery makes an entry. So this entry point can be figured out. If you taut this particular muscle by clenching this particular teeth, this muscle can be made taut. If you make this particular muscle taut, you can feel this anterior border of this muscle. If you feel this anterior border of this muscle at this particular point where it is lying in this particular mandible, we can find this particular entry point of this artery. So this particular arterial entry point of the facial artery can be filled, and pulsation of the facial artery can be taken in this particular region. So this point, which is a kind of pulse point of facial artery, we feel this pulse on the facial artery like this. Carotid pulse is felt like this by the sides of this particular neck over there in front of this particular sternocleidomastoid in the neck region. The pulse on the facial region is felt on anterior border of the masseter. So this is what they are asked to know during examination. Other branches which is coming from this external carotid artery, we call them as superficial temporal artery. So this artery, external carotid artery, goes and branches into two branches. We call this as transverse facial artery, and this one we see that running in front of the tragus. We call them as superficial temporal artery. So this superficial temporal artery gives a deep branch over here, we call them as maxillary artery. So this superficial temporal artery is running superficially. So in front of the tragus, this point of the ear we call them as tragus, in front of the opening, this particular skin fold over the cartilage. So this particular point in front of the tragus, we have another pulse point for the superficial temporal artery pulse. So this is another pulse point in the face region. So this is what examination takes place about finding the pulse on the facial pulsation and the superficial temporal artery pulsation. These are often picked up during surgery, especially by the anesthetic surgeons or anesthetic persons. They are picking up this pulsation on the carotid pulse, superficial temporal artery pulse, and these facial pulses. So these are our MCQ points where to take the pulse in the facial region or facial pulse, superficial temporal pulses. Now pulses of the artery, superficial temporal and facial pulse, these are the two things that you must prepare for your examinations. Now other than this, a little digging deep into this particular muscles that is present in this particular face over here. So this is what you have to learn, and you have to understand this particular muscles which are present in this particular face region out here. So, important muscles in the face region around this eyeball, we have muscle, we call them as Orbicularis oculi. So, this Orbicularis oculi, which is having a palpable part and orbital parts, which is present around this eyeball. It has muscle around the nose, compressor nasi, elevator nasi, depressor nasi, etc., etc. The muscle around the mouth, we call them as Orbicularis oris. So, this is what you have to know, the names of it, and the nerve supply, all of them are coming from muscle of facial expression, that means supplied by the facial nerves. So, that is how you are to study the muscles of the facial expression and muscle of mastication. Muscle of facial expression is Buccinator, which is present in the cheek region over here. In front of this particular region, we have a muscle, fluffy muscle, we call them as Buccinator. So, this Buccinator muscle is muscle which is helping to puffing. What do you mean the puffing? This puffing is known as blowing, like whenever you are blowing this particular region, just like you are going to blow a balloon, that particular muscle comes in action. So, that particular blowing action is done by this particular muscle, we call them as cheek muscle as Buccinator. It is also the muscle of facial expression. So, this particular Buccinator, which is a muscle of facial expression, the nerve supply is coming from facial nerve. So, this is what you have to know. This muscle which is present in the forehead region, we call them as occipitofrontalis, which is running front to back, occipital belly and frontal belly. Frontal belly is present in the front side, occipital belly is present on the back side. They are basically continuous on the scalp muscle. These frontal muscles, they are present in the frontal regions. This particular frontal muscle which is present are making these particular correlations like this. Occipitofrontalis basal muscle can be contracted like this. This muscle we call them as frowning muscle, we call them as corrugator superciliary. These muscles are making this frowning over here. So, this particular region is also supplied by this facial nerve, which is muscle of facial expression. This action we call them as closing the eye, supplied by Orbicularis oculi. So, this is making a movement over here. Zygomaticus major, minor, these are the muscle which are making an actions over here in this cheek region. So, Zygomaticus muscle which is known as Zygomaticus major, and under to it we have a minor muscle which are making a movement and a contraction in this region. Orbicularis oculi, around the lips, this particular muscle is making an actions. Risorius is a muscle which is attached with this particular muscle in the neck region, we call them as platysma, making this particular widening of the cheek. Now, around this particular mouth region, we have another muscle, we call them as depressor anguli oris and elevator angulis oris. They are working on this Orbicularis oculi. Mentalis muscle which is present in this particular mental region, that means in the front of this particular mandible, which is known as mental region or symphysis menti region. So, these are all muscle of facial expression. These are facial expression muscles supplied by the cranial nerve number 7. And apart from that, we have this muscle which you call them as muscle of mastication. They are known as all the chewing muscle. They are supplied by cranial nerve number 5, which is known as trigeminal nerve. Trigeminal nerve have got 3 divisions. So, this divisions of the trigeminal nerve is this. This is a trigeminal nerve, how it comes like this. So, this trigeminal nerve splits into 3 branches. Upper branch we call them as V1 branch, we call them as ophthalmic region. It supplies the ophthalmic region. So, we call them as V1. V by this, the Roman word, the 5th cranial nerve. We call them as ophthalmic branch. Then it goes to this cheek region. We call them as maxillary division or maxillary branch. We call them as V2, the 2nd branch. Then it splits into the 3rd branch, which is longer of course. It goes around the mandible. We call them as V3 or mandibular divisions. So, sensory divisions which is coming from here, V1, V2, V3, they supplies this particular region and as well as muscle of mastications which are supplied by this. So, this trigeminal nerve is a mixed kind of nerve, supplies the skin over here through these branches and as well as through these branches they innervate the muscles. That means they are taking the motor functions and as well as picking up the sensation. That makes this particular muscle as a mixed kind of nerve. So, these divisions we have to know what do you mean by the ophthalmic division, maxillary division, mandibular divisions of this particular trigeminal nerve. Detail of the trigeminal nerve will be covered in the neuro sections, but these divisions is present in the face region, that is why we have to mention about it. V1, V2, V3, that means ophthalmic, maxillary, mandibular. These 3 names you must know, and these names is supplying the sensory divisions around this particular region. You do not have to know the exact geometry of these particular innervations, but you have to know this face is supplied by the sensory supply coming from trigeminal nerve through these 3 branches, ophthalmic, maxillary, mandibular, and the motor innervation is coming from as well from the muscle of mastication coming from these particular branches or motor branches of trigeminal nerve. So these are the breakdown of the different nerves, like ophthalmic nerve, they are different branches, supraorbital, infraorbital, infratrochlear, lacrimal nerves, etc., etc. These are like things you can skip for now. Then this maxillary nerve also have branches, zygomatic, temporal, zygomatic, facial, infraorbital. You can skip these particular sub branches, but you have to remember these 3 branches of V1, V2, V3. That's what you have to know. And mandibular branches also have got nerves which is going to supply this small branches on divisions over here. So this is what you have to know. Now coming from there, you have to know about this particular blood supply of this face region coming from arterial sources. We call them as facial artery, the artery for this region. Along with that, face is supplied by the superficial temporal branch, which is coming from the direct branch of the external carotid artery, and as well as transverse facial artery. And the venous drainage of this is coming from this particular veins, which is known as facial veins, and as well as this particular veins has got like other veins which is communicating with the deep veins of this region, deep facial veins, and then have a communication with these deeper veins on the region of the face, and as well as through the brain. We call them as cavernous sinus. And you must know what do you mean by the dangerous area of the face, why this is area called danger area of the face, the clinical significance, or explain why kind of questions. Lymphatic drainage of the face region goes into this particular region. From the sides, it goes to the group of lymphatics which is lying in front of this ear. We call them as pre-auricular group of lymph nodes, also known as parotid group. Other lymphatics goes to this particular lymphatics which is going down below the mandible. We call them as submandibular. So these are the 2 groups of the lymphatics that you have to know. Pre-auricular, before the ear, also known as parotid group of lymphatics. So this particular region of the face drains to this particular parotid region, and then eventually drains to this particular submandibular group, and then to the deep group. So these 2 names you have to know: parotid group or pre-auricular group, and submandibular group of lymphatics. So lymphatics, that means if you have a facial infections in this region, this group of lymphatics will be enlarged. So that's what you have to know about this lymphatic drainage of this particular face. And this region also have couple of like salivary gland. Out here in the parotid region, we have these particular gland, we call them as parotid gland. This particular parotid gland is sitting in this particular side of the mandible. It has a superficial part, it also have a deep part. So this superficial part is seen in here, pierced by number of structures. So there are a number of structures that is piercing this parotid gland. So parotid gland have got parotid gland and a duct coming from it. We call them as parotid duct. This parotid duct crosses this masseter muscle anterior border, pierces this buccinator, opens into the vestibule of mouth against the crown of the upper second molar tooth. So this particular parotid duct is your exam short note, sometimes been asked in examination. In the practical, we tag this. The parotid gland also we tag it. Now piercing through this parotid gland, we have number of structures. This is what you are seeing here, a nerve emerging here, we call them as facial nerve. So the facial nerve splits into branches, superficial to deep, it splits into 5 branches. So then we will talk about these different branches later on. So this particular superficial branch you are seeing here is yellow one, this is a facial nerve. So which is splitting into 5 branches in this face region, which is running into the substance of parotid. Next to that, we have this artery which is coming over here, which is known as this carotid artery. So external carotid artery which runs in here and splits into several branches. So the external carotid artery also is a content of this particular parotid gland. And as well as this, along with that, we have the vein, we call them as retromandibular vein, which is present into this particular mandible, which is present as a content of this particular parotid gland. So if you see this particular parotid gland which is present over this particular side of the cheek region, have got number of structures, and it is pierced by these 3 structures that you must remember: facial nerve, retromandibular vein, and external carotid artery. So these 3 names you have to remember about parotid gland, besides the parotid gland itself and the duct which is present. Now this 3 structure that is running through the parotid gland has a relationship. The most superficial structure, that means if you cut the skin, you remove the skin, the fascia along with it, which is present in the face region, then we expose the parotid gland. You cut the parotid gland, then you get this particular nerve superficially placed. The nerve which is present in here, we call them the facial nerve. It splits into several branches. I am not going to talk about the branches of the facial nerve right away. Not now, later maybe. Now, if you cut this particular gland and cut this particular parotid nerve, facial nerve, then dig deep, then you find the vein. The vein which is running in here, we call them as retromandibular vein. This is the second structure that is lying deep to the facial nerve. So, then this is the second structure. If you cut this particular retromandibular vein, then you find another artery deep to it. We call them as external carotid artery. So, these are the structure that is embedded within this particular parotid gland. So, the moment the parotid gland is picked up during examination in organ, in viscera or in this particular ID, we ask these questions. What are the structure that is present or running through the substance of the parotid gland? These are the three structures: facial nerve, retromandibular vein and external carotid artery. Now, we ask the next question, what is the relationship? That means superficial to deep, you have to memorize this. The most superficial, facial nerve, intermediate, vein, deepest one, the artery. So, this is what you have to carry with it. This structure which is present with this parotid gland, and along with the parotid gland, this structure which is coming out of this parotid gland, we call them as parotid duct. So, parotid duct coming from this border of the parotid gland, we call them as anterior border of parotid gland. So, this anterior border of parotid gland coming through here, we have this duct which is running across this muscle. We call this muscle as masseter. Crosses this muscle, then finds this cheek muscle which is present in here. This is buccinator. So, this buccinator is pierced by this particular duct. So, this particular duct pierces it and runs obliquely, little bit obliquely. That means it runs diagonally, then opens into the vestibule of mouth, inside the mouth cavity, between the cheek and this gum, against the upper second molar crown, that means top part of here. So, where does this particular parotid duct open and what this particular parotid gland contains? Superficial to deep, these are what you have to remember at this particular point. Facial nerve, retromandibular vein and this carotid artery which is piercing through. So, what you have to remember out here is that is this region. Explain why. Face, this area of the face is called danger area of face. Explain why. Facial sensation, that means you have pain, boil, anything which is related to this particular region of the face. Who carries the pain sensation? The second point, which is V1, V2, V3. Third point, muscles. What are the muscles that are present in this particular face? So, in the face we have two sets of muscles. This is the one muscle of facial expression. Which nerve supplies to it? Facial nerve. All the muscles of the facial expression, you have to know the names of it. Go through the books, remember the names. What they are doing? Muscle of facial expression. Which nerve innervates it? That means motor supply to it. Then second set of muscle present in the face, we call them as muscle of mastication. That means they are working on TMJ, that making this particular jaw movement. So, what are the muscles of mastication? Masseter, etc., etc. Which nerve supplies to it? Motor supply to it? Trigeminal nerve. That means V. So, fifth cranial nerve and seventh cranial nerve, they are supplying this particular region. Blood supply to it, coming to this is facial artery. How do the facial artery look like? It tortuous. That means coil. And the venous drainage is coming from facial vein. Facial vein has a deep dig with the deep facial veins, with the facial veins communicating with the veins in the brain. Veins in the brain, we call them as one of the vein present in this vein in the brain, we call them as sinus. So, this particular sinus present in the brain region, we call them as cavernous sinus. So, infection from this particular region can go deep and infect the brain. How can it go deep? Because the veins do not have valves. It can run to this normal regions and as well as it can run backwards because it do not have check valves.